From the Delhi studios of Republic TV, it's time for the debate.
Today and talk about what we're going to be discussing in this segment. The countdown to May 1st, the largest vaccination drive that's ever been seen, is going to begin. Before that happens, when above 18 starts getting vaccinated, there are several focus points that need to be looked at. There are several challenges that need to be addressed, which we are going to look at. We're going to look at that in this report, and there are a panel of experts are going to be discussing that. Take a look at this report.
101 days into the vaccine drive, India has administered 14.5 crore doses so far. 4 days from now, we will begin world's largest vaccine drive as the age groups between 18 to 45 will start getting inoculated. But what are the challenges India has before starting the biggest vaccine drive?
Visuals from the BKC Jumbo Covid-19 Vaccination Center, where the people are here waiting since hours. We had a word with many of the people here, and they have stated that they have to wait for many hours. People with the age of above 45 people who have been waiting since many long, but they are waiting to get vaccinated.
Central government is countering states on the number of vaccine doses provided, even as state governments allege they are facing shortage.
1 मई से हम एक्चुअली 18 से 44 उम्र के लोगों की वैक्सीनेशन शुरू करेंगे क्या, तो ये सवाल का जवाब आज मैं भी नहीं दे सकता और कोई भी नहीं दे सकता, इसलिए कि वैक्सीन की अवेलेबिलिटी का सबसे बड़ा सवाल है। क्योंकि हमने चिट्ठियाँ लिखी है, हम कोशिश कर रहे हैं, जैसा कि अभी कोविशील्ड है, उनसे माननीय मुख्यमंत्री जी ने स्वयं फ़ोन पे बात की और यहाँ पर आके भी उन्होंने बात की, तो बहुत स्पष्टता से उन्होंने कहा है कि 20 मई तक उनका जितना भी प्रोडक्शन कैपेसिटी है, दैट इज बुक्ड फॉर गवर्नमेंट ऑफ इंडिया.
And another controversy plaguing the vaccine drive is the cost of the vaccines. Bharat Biotech is as of now charging 600 rupees per dose to state governments and 1200 rupees per dose to private hospitals. Serum Institute of India wants states to cough up 400 rupees per dose, while private hospitals will pay 600 rupees for Covishield. Centre wants these prices reduced as state governments have raised complaints.
इस समय में जब सारा देश मिलके कोरोना की लड़ाई लड़ रहा है, मैं समझता हूँ एक तरफ मैं वैक्सीन मैन्युफैक्चरर से अपील करता हूँ कि एक तरफ वो खुद भी इस प्राइस को खुद ब खुद 150 रुपये पे ले आएंगे। पूरी ज़िंदगी पड़ी है प्रॉफिट कमाने के लिए।
Will these issues be ironed out just before the Phase 3 rollout in order to ensure an effective immunization drive? Let's debate.
India's looking forward a vaccination drive that's going to vaccinate everyone above the age of 18. I'm joined on the debate by Dr. J.A. Jayalal, President of the IMA, joining us live from Chennai. Dr. Ishwar Gilada, Consultant of Infectious Diseases, Secretary General of Organized Medicine Academic Guild, live from Mumbai. Dr. Rahul Pandit, Director Critical Care Fortis Hospitals, joining us from Mumbai. Dr. Sanjeev Bagai, Senior Pediatrician and Chairman, Nephron Clinic, who's joining us from Delhi. Dr. Anil Bhoraskar, Diabetologist, Asian Heart Institute, Raheja Hospitals and Asian Cancer Hospital, also joining us from Mumbai. And also Dr. B.S. Ajay Kumar, Founder, Chairman and CEO of Healthcare Global Enterprises, joining us live from Bangalore. We have a lot of questions for our experts. This is something everyone in India has been asking. The questions, what are the big questions ahead of registration? What are the vaccine options? And of course, why vaccination is the only way out? As I've introduced my panel, let me straight go across to Dr. J.A. Jayalal, joining us, the President of the IMA, who's joining us live from Chennai. Dr. Jailal, can the registration individual who tries to get himself registered choose the location where they want to get vaccinated, or is that algorithm, you think, going to be decided from earlier? How many people do you think can be registered on the COVID platform, and will one login work for them?
Yeah, thank you very much. The current system of the COVID, which now it is open for registration, is not providing the people to get their nearest center. It is an algorithm based, and they have to be allotted according to the availability and where which center is nearby. So this is going to create some problem for the people, and people may not be able to locate the site which is nearer to them. That basically the two options should be available. 50% of these can be available through the COVID, but another 50% should be available for the walk-in facilities. And the person who needs and his nearby place is having the vaccine, he can choose that place and he can just walk in and have the registration on the spot. And if that is available, then it will be easy for both the people who are going to inoculate and the person who are going to get benefited. So we want, and we have already written to the government seeking this facility for the people to walk in and get the vaccination should be also included in the COVID and the mass inoculation procedure which we are going to plan.
Absolutely. Dr. Ishwar Gilada, I also want to ask you, will individuals be able to choose the vaccine they receive, whether it's Covaxin, whether it's Covishield, and is there any such vaccine shortage that some people speak of? Will that have any effect on this?
Basically, when it is a paid vaccination drive, people can choose the cost, what cost they want to pay, and that can be either Covishield or Covaxin, or maybe in a couple of days more other vaccines will come. But if they go to government setup, I don't think they will get a free vaccination between 18 to 44, because the government of India clearly said that government of India's vaccination program, free vaccination program, is only for 45 and above. So I don't think people have a choice. The problem will be that government of India said that states can choose their own way of vaccination, whether they want a particular age group or how they want to. So I don't think anybody would start between 18 and 25. Probably nobody demanded 18 and 25. We were all feeling that it should be 25 to 45 because most of those people between this age group, they are earning class of people. And up till now, people have been blaming. So I would.
Yes, I'll just go to Dr. Gilada. We've just lost that feed, and I want to ask Dr. Rahul Pandit also to continue in the stream of thought that Dr. Gilada was, and also ask you one more question on this, Dr. Pandit. How will the private players now be impacted from May 1st when the Indian government is going to require participation of private companies in speeding up the process of vaccinations?
Yeah, so just continuing from the Dr. Gilada's thoughts,
I think what he said is right. The government centers would
probably have no choice given to people who come to vaccinate, but the private centers may offer them a choice. And
as the weeks go by, if we have more players, more candidates for vaccine coming in, we would probably have more candidates which more vaccines available for common people to take up. Now, I think the private sector and the government sector has been actually shoulder to shoulder in the entire fight with Corona, COVID-19 since the start of the pandemic, and vaccination drive is no different. What we probably are going to see is that private players would need to work out how are they going to procure the vaccine. Whether the vaccine is going to be procured by the states and then distributed, or the private players are going to be able to talk with the manufacturers and get that. I think as of now, what I can say is that we will be dependent on the state government and the central government to deliver the vaccine. As the process becomes a little bit more streamlined, you heard that there is a vaccine shortage on the ground. We actually don't know whether we'll be able to start up with the vaccination program in full swing or not. That question needs to be answered. But what's most important, Rhythm, is that it will require micro-planning, whether it's private sector or public sector. Micro-planning will be required because this is the age group, 18 and above, who probably don't have that much of vaccine hesitancy. There may be hesitancy, but the sheer number is so large that you will actually find a lot of people wanting to come and take vaccine. So it would be good to have a policy or a strategy to divide time so that particular people can come up for particular times to take up vaccine. What I'm trying to hint is that there are still people above 60 who haven't had their second dose. There's still people above 45 who haven't had their first dose or second dose. We don't want old people to be standing in the same queue as the young 18-year-olds or 20-year-olds. So we will have to have a strategy to divide all of this so that there is no crowding, and at the same time, the vaccination drives run smoothly. Because previous experience has been that if crowding happens, vaccination centers actually behave like a super spreader event. We want to avoid that at any cost.
Yes, very, very important point. Something, Dr. Pandit, that will have to be very closely monitored by the government, especially when the tsunami second wave is here. I think that's something that needs to be paid note to. Also, I'm going to ask that question also to Dr. Sanjeev Bagai. What are the precautions that need to be taken to anyone who's going, Dr. Bagai, to a center? And also, how are the current rates that have been set up by Bharat Biotech and SSI mean for the Aam Aadmi? Bharat Biotech is charging 600 to a government hospital, 1200 to private hospitals. SSI is saying 400 to the government hospitals, while they're asking for 600 for Covishield. What does this mean for the Aam Aadmi?
Good evening, everyone. So let me be as ruthlessly honest.
Good evening, sir.
The first point is the present supplies which are envisaged to be coming out to fulfill the demands. According to me, we'll need much more than 2 platforms of vaccine. The minimum of 3 or 4 or even up to 5, and very quickly. So obviously it's a question of a gap between how much production is there and what is the demand. Point number 2 is if the stronger and quicker and tighter we hold on to the vaccine, lesser will be the impact of the vaccine. We have to liberalize it. We have to use every private player to vaccinate. Please understand that 75% of the Indian healthcare is private, and out of that 75%, more than half of it is family physicians and GPs. You have to not reinvent the wheels, but use the same infrastructure and the same magnet to have a greater population with greater catchment areas. Now, for that to be done, you have to use it like a routine immunization, but with the safety precautions of observation for 20 minutes, 30 minutes post-vaccination. Can you ever imagine someone walking in to get a hepatitis A or an influenza shot, first going through a portal, then standing in the line, getting registration done, then waiting again in a hospital, government or private? It's going to become tedious, and maybe we will falter. Maybe this is a self-tripping exercise. You have to liberalize it, keep the data monitoring, and keep the safety protocols. With regards, so that I'm absolutely crystal clear on this, unless and until we don't involve every medical player to give the vaccine, it will become counterproductive. We will not reach the target. The longer we delay, greater will be the chance that the mutations will become less effective against the vaccine. So it is in our interest that we do it as quickly as possible. It is important to understand that the vaccine is the only public health interventional tool, the strongest tool. With regards to costing, just 30 seconds more. With regards to costing, I'm also a very firm believer that it should be a uniform costing between the state and the central. And point number 2, it should be equitable and affordable. 1,200 rupees versus 600 rupees is bringing a huge disparity. If a family of 4 is going and twice, that means they'll be spending upwards of 6,000 rupees, which may hurt them. And in the end, what I would like to say in this segment as a summary point is that the private players' costing in terms of administrative costs and the injectable cost and the registration and the consultancy must be fixed. It should not be 1,200 plus the private players' fee. We don't want to burden the patients who are coming, because this is a pandemic, an extraordinary situation.
Very crucial points, Dr. Bagai, something that needs to be taken into consideration at a time when India is going to go on a massive vaccination drive. I also want to go across to Dr. B.S. Ajay Kumar. Dr. Kumar, I want to ask you, there are several other vaccines that are coming out. Of course, some are coming from abroad, but I also want to ask you about Bharat Biotech's nasal spray vaccine. It's going to stimulate an immune response, and its possibility of a much more non-invasive vaccination. Is that going to be a non-invasive vaccination possibility soon? And also several countries such as the US especially are going to give back to us the dosages they had taken of the AstraZeneca Covishield. is it for sure that there won't be any paucity of vaccines in India?
Well, first of all, I want to say that India, in both the vaccination, has done a reasonably good job considering the population. Having done over 100 million is a good achievement. But as a doctor and seeing patients across, we are doing thousands of vaccinations per day in all our hospitals across India. But one of the concerns is we are beginning to collect data where we are seeing, definitely COVID becoming positive even in those people who have had both the vaccination. So it is something, vaccination doesn't prevent anyone from taking precautions. See, one of the reasons the catastrophe has happened in India is because obviously we loosened. Nobody expected a second wave. And also vaccination was coming into force, so we felt comfort that everybody is going to get vaccinated. But now what we are seeing is the wave is in full force, and we know at some point it is going to reach a peak, maybe now. But the important thing is people have to be still cautious, wearing the mask, distance, and taking all the precautions, not going into crowd. And whatever lockdown has happened now is a little bit late, in my view. It should have been recognized a few weeks ago and done. But having had that, having done that, there is no need to do a postmortem and blame game. Now we all have to come together as a team and work, private, public, everybody, and make sure vaccination is done on a massive scale. Well, cost is an important factor. I want to say as a private enterprise, we should not make any profits from this. We should not really look at any profits. What is the cost of acquisition and how we can deliver it to the people who need this vaccination should be looked at. Particularly people in oncology, collateral damage is huge if we don't deliver this kind of vaccination. We are seeing this kind of damage happening already in our hospitals. All our hospitals are full. Even in our oncology hospitals, we are seeing COVID-positive patients, even though not to the great extent. But one good thing is those who have been vaccinated, when they get COVID, they're milder, and most of them are recovering. So while we are collecting the data and all, I think both COVID and Serum Institute are good. And the jury is still out. Only after a year from now, when we collect the data, we will know what is effectiveness of this vaccination. Regarding vaccinations coming from abroad, we know for a fact Pfizer and Moderna are all considered good. The IgM levels in these patients are very high compared to what we know about IgM levels for AstraZeneca and all. So this is a study which we have to do. Obviously, people will go for the Pfizer and Johnson & Johnson and Moderna when it comes. So we need to liberalize and make sure the doors are open so majority of the people can get it. It is affecting all sections of the population. Right now I have, out of 14 in my ICU, I have 50% who are below 45 in the ICU, who are on a ventilator. So it goes to show younger people are also getting affected. So we have to really work on it very hard 24/7. And my last suggestion I have is we have to panic should not happen. We have to create triage so that people are given comfort. Myself today on the phone, really, 50% of the calls we alleviated by comforting them and making them stay at home. People are rushing to hospitals for vaccinations or for oxygen and all. I think we have to take measures and give them comfort through triage so this panic does not happen and the world media will not cry there is a catastrophe. I think we can manage if done in an orderly way.
Yes. Absolutely. That's a very positive note, sir, and something one has to take into consideration. There is a lot of panic that is being spread, and we're completely against that because the situation, however grim, with our indefatigable spirit are going to and are very on the verge of conquering it. I thank you for that very good suggestion. I'm going to come back to you. I also want to go to Dr. Anil Bhoraskar, who's earlier also been on another show that we did specially for people with diabetes. Dr. Bhoraskar, I want to ask you, taking off from where Dr. Kumar was talking about the vaccine's efficacy. If we look at the efficacy of Russia's Sputnik V, it has 92% protection. If we look at Covaxin, it has 81% efficacy. Covishield has supposed to have efficacy of 90%. When so much data is there that vaccines do work, isn't it something, taking on that positive note that Dr. Kumar has spoken about, something that India is going to get a huge boost of when above 18 is going to get vaccinated, like he did say, 14.5 crore are already vaccinated in India.
Now, I'm very happy you got me on this program, and amongst the stalwarts, they have covered practically every issue. There are 2-3 points probably have been skipped due to lack of time, and one of them is the role of oxygen auditing. Now, I have a hospital, Rahej Hospital, where we are treating more than 117 patients of COVID. Now, I feel that there are very many high-profile people getting admitted, and they get admitted and they look at their oxygen saturation meters, and the moment oxygen saturation goes below 96, they tell the staff to increase the flow. Now, it is certainly not required that everybody should have oxygen saturation more than 96. In order to make it more than 96, these guys, with their might and weight in a private hospital, they bully the sisters and increase the oxygen rate to 6 and 7 liters. So a lot of oxygen is wasted because of these idiots. I'm sorry I call them idiots, because who has told them that oxygen saturation has to be more than 96? Up to 92, if the patient is not breathless, his respiratory rate is not more, is no tachycardia, we don't insist on giving high level oxygen. And we insist on giving prone position oxygenation. Prone ventilation given in the room can save oxygen and also prevent pulmonary catastrophe. So people trained. And what has happened, there are multiple agencies, multiple guidelines by multiple people. The most confused are the ones which are bigger organizations, and they confuse us more. Every day they keep on changing the guidelines. So I think we have to go on a basis of common sense. What tells us if there is acute shortage of oxygen, give oxygen. If there is an infection, treat infection. If there is a fever, treat fever. This doesn't need a great science. You don't need a great covidologist to start this treatment. This can be done by ordinary physicians. 90% of the RT-PCR positive and a CT scan correlate less than 6 can be managed at home. You don't have to rush to the hospitals and occupy a bed which may be required for a deserving patient. So I think the public attitude must change, and we have to educate people that what are the warning signals. Now, our knowledge in last 7-8 months has evolved. We are also learning new science. We are also realizing that diarrhea is one of the symptoms which we never had even imagined. So there are a lot of new signs and symptoms are coming up. We have to take that into account and give the warning signals to a patient so that he can rush to the hospital in right time and not panic. The phobia is killing this disease more than the disease itself. Why there is so much phobia and why there is so much confusion? The confusion is there because there are no two guidelines are along with each other. So, when you are dealing with such people in this country or all over the world, common sense medicine, my dear friend, and everybody will realize people who practice common sense, they do far better than who follow book and guidelines. I'm sorry, I'm very blunt, and that's why Arna likes me. And I don't mince words, and I tell you, Meri Man Ki Baat. This is what I want to tell, that we have to start auditing our oxygen utilization in the hospital and underutilize oxygen. We are using it too much and wasting it. Thank you very much.
Yes. Thank you. Thank you for that, Dr. Puraskar. Something that everyone needs to keep in mind, because lot of debate, lot of panelists who are coming on the debate and esteemed doctors have been saying this. It's something that needs to be kept in mind. There's so many other things that can be done other than the usage of oxygen in the hospitals and the ICUs, and people in panic should not be doing that. I take that point very, very clearly. I also want to go to Dr. J.A. Jayalal. Dr. Jayalal, I want to ask you, there are lots of states who've said there will be free vaccine, but there are a lot of states who've not said that. What do we do? And I also want to take this to Dr. Ishwar Gilada. We lost him in the middle with the technical glitch, so we're back to Dr. Gilada also. Dr. Gilada, if I can first come to you here. There are a lot of states who've not said there's going to be free vaccine in those states. What do we do with that? What will the price of vaccines in those states be? And if a particular person goes to a private hospital, how will they be charged, sir?
Basically, there's a vaccine politics going on. And we should stop that. It's a national program, as a national catastrophe, international catastrophe, but we are currently talking about national catastrophe. And we are in a very big problem because somebody just now said that we are not expecting second wave. Why we are not expecting second wave? When all over the world they have a second wave, we are not macho people. So a lot of people think that Indians are different. Our build is different. We are so system. So it is not so. Secondly, if second wave is such a big wave, we are only talking about Maharashtra, Delhi. You talk about anything, just now Health Minister of Assam was there. Probably he doesn't know that Assam has jumped in 6 weeks by 133 times. On 10th of March, they had only 22 cases. Today, there are 4,000 cases. So they don't understand the hinterland is totally full with COVID. Now, if we want to prevent this third wave, we have to have vaccination in a very big way, and all vaccination has to complete within 9 to 10 months because the life of vaccine is only 9 to 10 months. If we don't complete that, we'll have to start second round of vaccination. So, though we are taking a pat on our back that we have completed 11% of vaccination of the population, it is not sufficient. Secondly, we need to, at this stage, because there is a shortage of vaccine and we opened up to too many people, what we need to look at, those who have been RT-PCR positive, already infected, we can defer vaccination in them because I have seen in last 8-9 months, those who have been infected July or August, they are coming back with reinfection. But other people are not coming back with reinfection. Secondly, we are underutilizing antibody test. If we do antibody test, there are a lot of people who did not know that they have been COVID positive, but they are antibody positive. That means they have been silently infected. So such people, they can defer vaccination. And then we can concentrate on those who are eligible. In that way, we can at least 30 to 40% people can be deferred. If you just talk between 18 to 25 years of age, 12% of the population is between these 7 years of age. We can defer even 18 to 25. So if we do proper planning, and secondly, what I would like to tell, there are 12,70,000 MBBS doctors. I'm not counting BAMS and all other pathies. There are 3,70,000 postgraduate doctors, total 17 lakh doctors. Even if 20% of them are utilized for vaccination, and it is not a rocket science to give vaccine, we have been all giving all our lives. So we have 3 lakh doctors. Each doctor giving 100 vaccines, we can cover 3 crore in a day. Even if we cover 1 crore in a day, we can cover 60-70 crore in 60 to 70 days. So it is not a big, what we have done in bigger mistake in India, we have been training those people who doesn't know vaccine, who doesn't know how to fill up the syringe. We are telling them remove the bubble like this, and we had seen wastage of 6%, 8%, 15% vaccine wastage. In vaccine, actually, they have a 1 dose extra. If there is a vial of 10 doses, there are 11 doses. So if you are intelligent enough, you can have 10% extra vaccination. People here are losing 10%. So there is a 20% wastage. So there has to be a vaccine audit,
yes,
oxygen audit, bed audit, remdesivir audit. Everywhere there has to be audit.
Yes. Okay, that's a very critical point. I also want to take that to Dr. Rahul Pandit. Dr. Pandit, you're also a member of the Maharashtra COVID Task Force. You're a Director of Critical Care at Fortis Hospitals in Mumbai. What are the kind of issues you've seen? This is a critical issue that's being raised also by Dr. Gilada. But the larger picture, vaccine is the only answer that India has as of now to inoculate ourselves, to protect ourselves. What are some of the problems you're experiencing that have to be addressed at such a stage?
There are two things here. One is vaccination as quickly as possible, which will actually help us to mitigate the third wave. Because when the second wave comes, the third wave is already looking at you, it's already staring at you. And there are several points which I would like to mention on the third wave thing. But the things on the ground which I would like to mention, which are currently being faced is, I agree with Dr. Gilada, we need to have and Dr. Boraskar, that we need to have a good oxygen audit. Every hospital, however small or big it may be, should have an oxygen audit committee, and they should do the oxygen audit for themselves. They should look at the utilization, they should look at patients who are on oxygen, how much oxygen are they requiring. They should also go beyond the clinical care and look at points where the oxygen may be leaking. Right now, it's almost criminal to have a wastage of oxygen. Pipes and bolts and nuts which need to be basically fixed up so that there is no leakage of oxygen. The second thing is, we need to have a proper and appropriate use use of drugs like remdesivir. Now, remdesivir, we all know, and I'm telling this on the national TV, I'm sure many other people have said that, has not shown to change mortality. Well, it does. It is an antiviral drug, and it does decrease the viral duplication when it is given in the right time. And the right time to give it is between the 2nd to the 9th or 10th day of onset of symptoms. After 10th day, it probably doesn't have any role to be played. Also, it should not be used in patients who have mild or asymptomatic disease, or in patients who have severe disease with multi-organ dysfunction, because in either of these categories, they are not going to have any effect of remdesivir. So the right person to give is the patient who has a moderate disease or moderate progressing on to a severe disease. And the third important thing is 5-day course, which is 6 doses. First day you give 200 milligrams and then 100 milligrams for the next 4 days is what is required. 5 days is as good as 10 days. Number of studies have shown that. If we just utilize this clinical knowledge and put it into practice, we will probably save half of the remdesivir which is being utilized right now, and more people who are deserving will get it. So similarly, we need to do an audit of all the other available things, which would be beds and everything else. And if we just have to be a little bit smart to do that. Now, coming just to half a minute, I'll take about mitigation of third wave. We've been actually talking about this. So the 3T approach, which is there, which is testing, tracing, and treating, actually needs to be ramped up as the cases of the second wave start going down. We should not be decreasing it. We should be doing a smart testing. Smart testing means if you notice that a particular area of a city or a particular village has got many positive cases, you actually have a microgeographic containment of that area, and you test patients as many as you can and test their contacts as many as you can from that particular area. So if a city or a village was doing X number of tests, we need to probably do X plus 1 number of tests out there. We should not be decreasing the testing. The second thing is smart vaccination also. We need to have more genomic studies to understand which variant is present in which area, and if there is immune escape which is seen from the vaccine which has been given out there. That would be the right way to vaccinate. So if you have a particular strain which you feel that they have an immune escape from a particular vaccine, you vaccinate them with the best available vaccine which would be pertinent to that strain and would cover that strain up. These are some of the smart things which we could do. Stop the super spreader event for entire 2021. Weddings, gatherings, social gatherings. We have to curb them down for the entire year. If we can do all of these things, I think we will mitigate the third wave. We should not, we will come out of this. There is a very positive note to that which I am saying. I'm not trying to put up any fear or anything. I think we do simple things. Double masking. When people step out of their house, you wear a double mask. These are some of the simple things which we could do and mitigate the third wave.
Absolutely, that's something very, very important that we have to keep in mind, and something that needs to be done, because it has been the super spreader events that have also led to this. We've seen it, whether it's been, I don't even want to comment on whether it's been festivals or elections, but I want to come back to a debate, or rather a discussion that is throwing light on the May 1st date when vaccination for above 18 will become a reality in India. I go across to Dr. J.A. Jayalal, who also I wanted to ask a question when it comes to super spreaders. A lot of people will now be going to government hospitals, private hospitals to get vaccinated once they've got their appointment on those on that app. The critical point here to mention is there safety when they go? What are the precautions, Dr. Jayalal, that they need to take once they're at the place to take their own vaccines?
Yes, thank you. I'm very much fascinated by the title which you have given, India Get Vaccinated. But that is our goal, and whatever the obstacle which is going to come in that definitely we will be able to overcome that. As you rightly said, there's an overcrowding at a particular place, may serve as a super spreader. But we have a lot of system in our country where we have a lot of PDS distribution, where entire village, entire area we are able to distribute. We have a voting system in which we are able to control the voting, people coming in a particular place. And now we are now spread out, more and more centers are now opened up. It is not only the one private public hospital. The government is very cautiously, very carefully, they have opened multiple private care centers. And the extent that we are expecting that all the private practitioners, even if the small single-man clinic, that will be opened up for the vaccination. So definitely that will not add the crowding the people. People can choose at their own time. And as the COVID app is there, they can be able to preferably and get the place of nearby place, and they can come and get the vaccinated. And we are taking adequate steps in all the hospitals, like that what we are now following in the airports or what we are following in other places. And the people are kept, even if it needs to be a queue, they will be kept for the at least the 2 meter feet away. And the appointment time will be given at a different time. And every time when the people are coming, there will be not be any opportunity for them to mix together. And this precaution we need to take care. And also, as rightly said by all the panelists, the double masking or at least a masking with a good surgical mask is a mandatory requirement whenever they are coming for the COVID center. So with that opportunity of taking care, this is going to be happen in an observed way. It is going to be happen for the learned colleague. It is going to happen for the people who are experienced in standing in queue. I am sure that we will be able to overcome that and we will be able to ensure that they are getting vaccination. The only issue which will come for the pricing, as we have already discussed, the pricing should be uniform. There should not be a preferential pricing, and the government should come forward to see to that everyone, whether they are coming to the private or public, will be able to get it at a nominal or affordable price, and that is going to help us to get your goal. India, let it get vaccinated to save us and save the country from above the corona pandemic which we are facing today.
Yes, absolutely. I also, when I asked Dr. Sanjeev Bagai the next question, want to say, like we're saying, India gets vaccinated. This is a time for India to be stepping forward. We're all going to be vaccinated. I also want to throw some light, Dr. Bagai, before I come to you, on all the places where vaccination has taken place in the world and how it's been. Whether it's the Israel model, where Israel had lifted the public mask mandate and fully restarted the education system after having achieved 100% vaccination. The UK model, when the UK eased restrictions after partially vaccinating 32 million people. The Italy model, where Italy achieved a major milestone of successfully vaccinating 5 million people and making 28.5% of the country's population partially vaccinated. All these places give us hope. Whether it's the US model also, where 75 million shots included 80% of the teachers and school staff who've received the vaccination, or the Japan model, which is now setting up centers, each of which will have a capacity of vaccinating 10,000 people. It's clear, Dr. Bagai, every Indian registering for the vaccine and getting the jab is the only way out for India also.
Okay, so as quick summary points, most data which is in US and in European Union altogether, which encompasses more than about probably 15 or 20 million doses, the chance of reinfection is 0.001. That means this vaccine is almost 99.9% effective in preventing disease, admissions, and death. The second point, which is important to understand, is this is your only weapon which you have. So vaccination, apart from all the vaccine hesitancy and all the myths which are floating around, even the ICMR data has shown the first and the second dose, post the first and second dose, the effectiveness is 0.03 reinfection and 0.04. That means it's dramatically good. The critical point which I want to drive home is vaccination without a mask is zero. You cannot forget to wear the mask for the better part of this year. I am entirely convinced that this is going to stay for many months, this infection, and perhaps we may even see a small surge towards the end of the year. This indeed may actually become endemic. When I say endemic, the reason I'm saying this is we are not doing enough of genomic sequencing. Till you don't know what type of strain you're dealing with, you may be in a quandary in the latter part of this year. So when you're doing the serosurveillance from antibodies, which is according to me not that important right now, because it's T cells which are more important than neutralizing antibodies medically, what we need to focus is on genomic sequence so that we know which strain, which mutant is in which part of the country. Now, having said that, if we had isolated the bunch of people in November, December, January, who were indeed carrying the UK mutant, which apparently is the rampant mutant in India now, we would have well contained it by then. So I think we have to have horses for courses. We need to recalibrate our strategy very quickly because the target is moving. Our gun also has to move accordingly. We can't be complacent. The only way to get back to normalcy is vaccination. And I want every person to hear it loud and clear who's watching this program. The vaccines are safe. There is no short-term or long-term side effect. There is no evidence to show that it causes any risk of blood clots, which is worthy of discussion. It causes no long-term consequences, either in your impotency or your body organs. It has no live virus. Please go as soon as you get your appointment and get yourself vaccinated.
Very, very positive note. We have to very easily mark the words of Dr. Bagai and all the doctors on this panel discussion who've been re-emphasizing it's vaccines that is the way to go. 99% efficacy or 99% protection is what they are saying will be given there. Dr. B.S. Ajay Kumar, I want to ask you a little more details about the COVID application, the COVID platform that's going to be there for people to register in. How soon do you think people who try and register on it will be able to get an address, will be able to get themselves vaccinated?
I think the vaccination, like some of the speakers said, availability will be there, the sites. The only question will be if there is a mad rush after May 1st. And again, it is like riding on a petrol bunk or a gas station. I think it may overwhelm the system whereby there will be panic, in terms of how they will get it. So if it is done in an orderly way, like we said, how we do the voting and all some other speakers, it can be done, and I think India is well prepared. One of the concerns I have is really availability. Obviously in the media there has been a lot of talks about vaccine not being available, and procurement of raw materials coming from outside India. And of course, now they are saying it will all come. But I think this really is something which we have to be concerned, and we should not be reactive but proactive. We have to make sure all the ducks are in order once we open the gates for vaccination on a massive scale. And if you do it properly, it will go very well. If you open the doors but you don't have enough vaccination to give, and you put up boards, vaccine not available, it will panic. People will panic, like the oxygen scenario. I think similar thing can happen, and in the past we have seen it happen on the banks or petrol bunks and all. So and even today in the oxygen we are seeing it, in the drugs where people are panicking and coming to hospitals. So similar things should not happen. And I also want to say vaccination, our own practical experience, is not all. It is not 99%. We are seeing people with 2 vaccinations coming with COVID, milder variety. So precautions, even abroad also, people who have had 2 vaccinations, they are saying that they have to be taking precautions and see whether the third wave will come. If you look at the history of COVID, 1 year ago, we thought, we got it. We thought we reached a peak by September, October, and we were all comfort level, relaxed, and boom, it came. So now we have to see with vaccination also whether it will happen, or with the new strain coming, as we were talking about genomics, new strain, a third one, fourth one, will it overcome the resistance to vaccination and again come? So we have to take precautions. We cannot have Kumbh Melas and other Melas. We have to be very clear. This cannot be allowed, and the contagious spread of this is huge. The effect of that is huge, and we have to contain and restrain ourselves for at least a year or more until we know how this is going to play out.
Yes,
Eventually
yes.
it will subside and we can play out. But until then, we have to be extremely cautious.
Absolutely. As I thank Dr. Kumar, all my guests for being with us, it's been extremely enlightening to understand what India needs to do. 2 things that are very clear as India goes into a vaccination drive on the 1st of May. Get vaccinated quickly. It has 99% protection for you. Wear a double mask. Stay strong. Most importantly, it's one for all for one. I thank all my panel experts for being with us. Have a very good evening, India. Thank you for being with us.